So I'd like to welcome everyone and thanks folks for attending this special webinar. My name is Ben Knoll. I'm the Director of Patient-Centered Research at the Global Healthy Living Foundation, CreakyJoints, and also a co-principal investigator for Arthritis Power, one of the patient-powered research networks within PCORNet, the National Patient-Centered Clinical Research Network. And we are hosting these webinars to provide more information to patients about research topics of interest. And this evening, we're very lucky to be joined by Dr. Kevin Deane. He's at the University of Colorado, Denver. He's a rheumatologist there in the School of Medicine, and his research interests are primarily in the preclinical identification of autoimmune disease. And he's currently working, he's a co-investigator in an NIH-sponsored study looking at the relationship between genetics, environmental exposures, and the development of rheumatoid arthritis related autoimmunity. So it's very relevant to a lot of the folks, especially in our network. And it's more generally, I think, of interest to people within our collaborative research group within PCORNet. So we're thrilled to be offering this webinar tonight and delighted to have you join us, Dr. Deane. So with that, I'll hand it over to you. And thanks again for agreeing to talk to us tonight.
Great. Thanks, Ben, and thanks to all the participants here. I'm glad you're here. I'm glad to be able to talk with you tonight. Thanks especially to CreakyJoints and Arthritis Power and others to allow this to happen. So I am going to talk tonight about a new concept in autoimmune diseases that is now predicting and preventing autoimmune conditions. And I'll hopefully explain that more as we go, how exciting that is. And I'll really talk about what research has told us. I'm going to do this at some points at pretty high levels and then kind of drill down into a little bit, and there'll be opportunity for questions at the end. So hang on to your questions. Ben, if you can correct me, I think we're saving them to the end, but make sure you write them down if you have them as we go.
That's right. Yep. Thanks.
So I'll start off at a high level and just describe what the immune system is. And I apologize if many of you already know this. But basically, the immune system can be thought of as a set of processes in our bodies that normally help us. So these help us fight infections. So when you get a cold, you clear the cold virus out and you get better in a week or so. It helps us heal wounds. And on an ongoing basis, our immune system does what we call surveillance, and it finds abnormal cells in our body and most of the time takes them out, cleans them out. So this helps prevent cancers in most of us. So that's the normal job of the immune system. It's made up of many parts to be able to do that. The two big components that I'm going to talk about today are the white blood cell part of your immune system and then the antibody part. So white blood cells are cells that are called neutrophils, B and T cells. These initially got called white blood cells because when you get enough of them, they actually look white under a microscope. Or if you've ever seen pus in a wound, that's just a lot of white cells, a lot of white blood cells. Again, neutrophils, B cells, and T cells. And then there's antibodies. And antibodies are particularly important because we all make them all the time. They are made by our B cells, and they're proteins that can actually attack invaders like infections or cancers. But sometimes these can be markers of autoimmune disease, which I'll tell you more about later. But those are the big parts, white blood cells and antibodies. And so here's a pictograph of what these cells and antibodies do. So over here we have neutrophils, T and B cells, and then a bad thing comes along, like an infection or cancer. Neutrophils and T cells can attack these infections or cancers directly. B cells can attack directly, but they also make antibodies that can then bind to these things like infections or cancers and help destroy them. And notably, the immune system can be trained to fight certain things. Now, we do this naturally on our own. When we get exposed to an infection, we mount an immune response. Once we clear that infection, then our body keeps hold of antibodies and T cells and B cells that can attack that infection. So the next time you encounter that infection, they're raring to go, and they can clear it out much more quickly the next time around, or even prevent you from getting infected. And then we also can manipulate this ourselves to train your immune system to fight certain things. And this is the whole idea behind vaccines. So We've learned over time there's a certain set of infections that are really dangerous, especially in childhood illnesses, and we give vaccines for those. These are now vaccines to chickenpox, diphtheria, measles, all these things we make vaccines for. So basically train our immune systems to be able to recognize these infections and then fight them off. And we're working now on getting vaccines for things like cancer, and I'll talk to you at the end about potentially vaccines against autoimmune diseases. So now I'm going to turn to what are autoimmune conditions. So these are, simply put, conditions where the immune system, instead of doing its normal job of clearing infections, clearing cancers, or helping you heal wounds, it attacks you. There's many types of autoimmune conditions, and the name of these usually is based on the organ that's attacked or the condition that develops, and I'll talk about this a little bit more later. In total, autoimmune diseases affect about 10% of the population. Now, this is that same pictograph you saw, but there's going to be some changes. I already went through what this immune system looks like if there's a bad thing like infection or cancer. But in autoimmune diseases, basically, instead of attacking those other things, your immune system's attacking you. And then in this case, the antibodies are no longer called just antibodies. They're called autoantibodies, which means auto is you, so these antibodies attack you. And I'll talk more about this in a couple of slides, but basically how this autoimmune diseases occur is something goes wrong in the immune system training, and so instead of doing its normal job, now it's turning on you. As a little step back to help define some terms that I'll talk a bit more about, autoimmunity is sort of what doctors think about, but a lot of times people understand this in terms of inflammation. So inflammation is a more general term for a body's response to an injury. It can be good in many cases. It helps fight infection or heal wounds, or it can be bad and lead to some conditions like heart disease. All those are part of the spectrum of inflammation in the immune system in the body. I think is a good example of this. If you get cut, when that wound heals, it can be red and even raised up a little bit as it's healing. That's inflammation, and that's actually good inflammation. That's your body coming together to heal that wound. Then there's also autoimmunity, which is a subset of inflammation. It's typically more specific when there's been an adaptation of the immune system to be directed against a certain part of your body. Interestingly, it can be present and not harmful, so a lot of us can harbor autoimmunity but yet not have any tissue injury or disease. But it can be present and harmful, and when that's the case, then we call it an autoimmune disease. And here's some examples of autoimmune conditions. Lupus is over on the far left here. Lupus is a disease where the immune system gets retrained to do the wrong thing. It attacks the person, and it can attack a variety of things. In this case, this is an example of where the immune system is attacking the skin, can attack the kidneys, the joints, a lot of other parts of the body. Here's a picture of rheumatoid arthritis in the top. This is a disease where the immune system really attacks the joints and leads to a pretty significant destruction if it's not treated. Here is a type 1 diabetes. This is just an example of someone giving themselves insulin, but the reason they're doing this is because the immune system has attacked the pancreas. The pancreas is the organ that makes insulin. The immune system attacks the parts of the pancreas that make insulin. The person can no longer make insulin, so they have to take it themselves. And here on the bottom right is a picture of gout. Now, we didn't used to think of this so much as an autoimmune disease, but our understanding of it's growing now that in individuals as we get older or certain conditions occur that build up something called uric acid in our body. That uric acid can form crystals, and the immune system just attacks those crystals, leading to really brisk inflammation. And here on the far right picture on the bottom corner where the arrow is, that's actually gout crystals oozing out of the skin, and you can kind of see whitish material in there. Those are white blood cells that are trying to attack that gout and get it out of there. In the middle here's a much longer list of other diseases that we consider autoimmune conditions. These can include hypothyroidism. Hyperthyroidism is also an autoimmune condition. Celiac disease, Crohn's disease, ulcerative colitis, psoriasis, and arthritis that can come along with that, or ankylosing spondylitis, are all autoimmune conditions. I put at the very bottom here osteoarthritis. This is a little bit controversial. In the past, we used to think of osteoarthritis as more of a wear and tear or mechanical problem and not an immune condition. But the more we're learning about osteoarthritis, we're realizing is, yeah, it can have injury to the joint that can lead to osteoarthritis or joint damage, but then the immune system steps in, and it's actually imbalance in the immune system that leads to progression of osteoarthritis. And it's opening up a whole new world of research into osteoarthritis. And right now, while we treat osteoarthritis with joint replacements or surgeries or agents just to kind of reduce pain, in the near future, I really believe we're going to be starting to treat osteoarthritis like an autoimmune condition and trying blocking inflammation in that. So again, if you have any questions about that, save them and I'll answer them later. So looking back further at the immune system, it really likes balance and really likes to lean towards health of the left side of the picture, the green, cool, soothing side of this picture. And it's only when inflammation comes along and it gets out of balance that this can transform into an autoimmunity and disease. Again, not all inflammation is bad, but when it gets out of balance, that's when we get problems and we can ultimately develop autoimmune disease. So a big question that comes up is, well, what causes autoimmune diseases? And I won't have the answer for everything here, but there's the general idea that inflammation is out of balance, tipping the scales of the immune system towards autoimmunity and disease. But well, what can drive that inflammation to go down the wrong pathway? Well, there's a lot of things. Genetics are a big one. The genetic building blocks we have in our bodies can make people more prone to certain kinds of inflammation and to develop autoimmunity than others. So there's also a lot of environmental factors that can drive our body towards inflammation. Infections are a big one that we're really starting to take another look at here recently as potential drivers for abnormalities in the immune system and development of autoimmune disease. And infections are kind of divided into two types. One are infections that might cause an acute illness or a illness that comes on all of a sudden. That would be like colds or flus or pneumonias, that type of infection. But we're also understanding that there's something called the microbiome, which refers more to the bugs that live on us all the time, don't really make us sick, but they may subtly influence our immune system's development or responses to other things that may alter us and make us more prone to autoimmune disease. I won't go much more into that right here, but feel free to ask any questions down the road. Other things we know that are environmental factors that drive the body to have inflammation and bad inflammation that may lead to autoimmunity include exposure to tobacco smoke, in particular cigarette smoking. And then diet and nutrition are often big factors in driving inflammation in our bodies. This last part is a little more vague, but I think it's something we're learning more about in the field, is that the immune system can make random mistakes. These are often, though, in the setting of reversible factors, like chronic inflammation driven by tobacco. But another example is fat cells in the body. So our fat cells make inflammation. And if we gain weight, that can make more cells that are making inflammation. And that chronic inflammation from that can actually drive your immune system to make more mistakes because it won't let your immune system shut down and regain balance. And we think that can predispose people to getting autoimmune diseases. We're getting more and more information that obesity is a risk factor for a lot of autoimmune conditions, including rheumatoid arthritis. So now I'm going to talk a little bit more about the preventive side of things. But right now, most autoimmune diseases or conditions are treated once an individual feels sick. So I'll use as an example here rheumatoid arthritis. So when somebody has painful, stiff, or swollen joints, they go to their healthcare provider and say, look, I don't feel well. They identify this inflammation in the joints and say, aha, you've got rheumatoid arthritis, and then put you on therapies. So really that depends on a person feeling sick, getting a healthcare provider diagnosis of a disease. But are there ways to predict who's going to get an autoimmune condition before they actually feel sick? And this is the whole concept of prevention, finding someone before they really get ill and then trying to intervene at that time period. So there's lots of ways we can predict risk for future autoimmune diseases. There's things like family history. So if a certain disease runs in your family, you may be more likely to develop that disease yourself. There's genetic testing. I will just say right up front, this is not widely available for most diseases, especially in autoimmune diseases, just because we haven't learned enough about how to transform genetic testing into specific tests that can give a person useful information. And there are certain environmental risk factors. So we know that people that smoke have a higher risk for all sorts of autoimmune diseases. But one of the things that's really emerged in the last 10 years or so is that autoantibody testing can be very predictive of developing future disease. So there's lots of autoantibodies. And again, these are these antibodies that we all make antibodies, but these are antibodies now directed to you and not some other thing like an infection. There's lots of them. They're disease-specific. Some of the common ones that people know about are ANAs, or anti-nuclear antigens. Those are very commonly associated with the disease lupus. Then in rheumatoid arthritis, there's a couple, rheumatoid factor and a newer test called anti-CCP. These are really good for these two diseases, lupus, the ANA, and then the rheumatoid factor and anti-CCP for rheumatoid arthritis. We're learning now that for most autoimmune conditions, the autoantibodies can be detectable in the blood for 3 to 5 years before feeling sick. Although the important caveat here is, even if these antibodies are present, it doesn't always mean that someone is going to get sick. So that's part of the balance with these things. We can predict with fair accuracy who may develop a disease in the future, but it's not perfect yet. Of course, then, if you can predict a disease, the next question is, can we prevent an autoimmune disease? And here's where the field's really in its infancy, but I hope in the next few years we're really going to see a lot of development here. But the concept of trying to prevent diseases has been around for a long time. So we already have a lot of nice preventive approaches for infections, and we have vaccines. So basically, as kids, we all get a bunch of vaccines now, and it helps prevent us from getting a lot of deadly illnesses. We now know how to prevent heart attacks with things like cholesterol treatment. Nobody wants to have somebody come in with their first symptom of having heart disease, of crushing chest pain and feeling short of breath and miserable. We want to catch you when you feel good, identify that you may have high cholesterol, which is a risk for heart disease, and then treat the high cholesterol either through diet or medications, and then prevent that disease down the road. We also work very hard to prevent deadly cancers with cancer screening. These are things like mammograms or colonoscopies, where we're able to find a cancer in a very, very small state before it harms you, get rid of it so it never develops into a deadly cancer. Again, as I've mentioned, though, this is a new area for autoimmune diseases, but a combination of things, to understanding how the immune system works, how these autoantibodies may appear before disease, is really opening up the field. And here's a slide with just a lot of pictures, but I hope this will help understand what we think the immune system does in autoimmune diseases and how prevention may work. So way over here on the left-hand side is a candle. This represents an immune system that's fairly healthy, maybe a little hot, with a little bit of flame. In the middle here is a campfire. This is an immune system that's a little bit more out of whack. Person may still feel fine at this stage, but there's a growing fire. Then, of course, here is a major forest fire, which I think, if we all know, although if you live in a couple of states, California for one and Colorado where I live for another one, we have major fires every year. Once they get to this stage, there's really very little you can do to put them out. You hopefully contain them, and then they just burn out on their own. But this is a stage when you don't want to have a person come to you in this stage where things are fired up, like this top picture here, rheumatoid arthritis, this gout, or this lupus patient. You really want to catch them at these earlier phases when they're probably more easy to put out. Everybody knows it's pretty easy to put out a candle with a quick whiff or a quick pinch with your fingers. A bucket of water will do this, but it's going to take a lot to put out that forest fire. Right now, we actually do have some things that we can do to help reduce people from progressing from a little bit of autoimmunity to a bigger and to actually full-on disease. These are things like lifestyle changes, like smoking cessation, maintaining a healthy weight, and maintaining a healthy diet. These are things that we should all be doing all the time to help prevent us from developing autoimmune disease, no matter what our risk. The nice part about these things is they have a lot of other health benefits. We know that smoking cessation reduces risk for lung cancer, reduces risk for heart disease. Healthy weight and healthy diet reduces risk for a lot of diseases, including cancer and heart disease. Because I brought up healthy diet, I just wanted to mention one thing. People often ask, well, what is a healthy diet? I will say science doesn't know the exact right answers in terms of large-scale studies, but lots and lots of small studies and some large studies have really supported that in terms of the immune system health, a Mediterranean diet is probably the best approach to reducing your body's bad inflammation. In a Mediterranean diet, I'll refer you to CreakyJoints website for more information on that. They have an outstanding section on diet. But this is, in general, less meats from animals that run around on the ground and more whole grains, vegetables, oils such as olive oil or fish. That's in general what the Mediterranean diet is, and it's really been shown to be not only heart healthy, but healthy for your immune system. And I think in the near future, while this is still in the near future, what we are going to be looking at is the use of medications, nutritional supplements, altering people's own bugs that live on them or altering the microbiome, as well as developing vaccines that can help prevent someone from marching through the phases of immunity to the point where they have an autoimmune disease. Again, these things are coming. We don't know a lot about this yet, but I think this is on the near horizon to really be able to alter how autoimmune diseases develop and prevent people from developing what we see on the right-hand side of the screen. So at this point, how can you participate in autoimmune disease prevention? There's a lot here, and I'll be happy to answer questions. But first is know your risk. Certainly understanding family history for disease does help you understand your own personal risk. We know diseases like lupus, rheumatoid arthritis, gout, osteoarthritis really do run in families. Each of those diseases has a little bit different family risk. For example, rheumatoid arthritis, if you have a family member with rheumatoid arthritis, your personal risk goes up about to 3 to 5% lifetime risk for getting rheumatoid arthritis. That may not seem like a lot, but that's over the 1% risk that the general population would have for rheumatoid arthritis. Risks can go up higher in diseases such as type 1 diabetes or lupus. So know your family history can help assess your risk. Talk to your healthcare provider if you have any questions. Now, not a lot of healthcare providers are expert in all the diseases, but they should have some general information about your overall risk for autoimmune disease if it runs in your family. And then we can all adopt lifestyle changes, even if we don't have a high risk of disease, that can help us have healthier immune systems. This includes healthy diet, and we talked about that, the Mediterranean diet. I think given what we know now, that's the best data. Maintaining a healthy weight, and then smoking cessation. Those are three relatively straightforward things to do to reduce your risk for autoimmune disease and maintain a healthy balance. Now, these things are not easy, but they are pretty straightforward, at least, to try and approach. The next thing, this is my promotion for research. We are really at an early phase of understanding how we can prevent autoimmune diseases. So really the research community needs people who are at risk for disease to help participate so we can learn more. So in the next 10 years, we can know a lot more and then really be able to do some very, very good preventive activities in the future. We'll just add this, autoantibody testing, which I mentioned before, is a very good way to predict who may be at risk for future disease, but it is still mostly in a research phase right now. So if you went to your regular doctor and wanted to get tested for these antibodies, they may push back and say, let's not test that now, we don't know what to do. But I think in the near future, we're going to start seeing these things be more and more accepted as ways to identify people who are at particularly high risk for getting an autoimmune disease in the future. There are multiple research studies into autoimmune disease prevention out there, and here's a couple of websites that you can go to learn more about this. So I picked three of the big ones that are out there now. Type 1 diabetes. There's a lot of different studies into preventing type 1 diabetes that can be applied to family members of people who have individuals with type 1 diabetes in their family. This trialnet.org website is terrific and kind of directs you to a lot more information about that. Rheumatoid arthritis, which Ben spoke about earlier, this is a study that's first of its kind in the United States where we're identifying people at risk for future rheumatoid arthritis based on a blood test, one of those antibodies I talked about, the CCP. We're randomizing to receive a drug or a placebo to see if we can stop people from progressing to rheumatoid arthritis. There's more information at this website. And then, very exciting, Lupus is also launching a prevention study in rheumatoid arthritis. It's a bit of a long website here, but if you want to search SMILE, S-M-I-L-E, like a happy smile, lupus prevention, that'll get you there. Or if you have a chance to write this down, you can find that more information about that in prevention lupus. And I think if you also go to CreakyJoints, they're going to be able to, over time, start updating on what trials are out there, what things are available to you if you're interested in specific diseases. I'll just let this sit up here for a second. Now is the time for questions. So I'll turn it back over to Ben. I think they have an approach for you guys to address any questions, and I'll answer them as best I can.
That's right. Yeah, thanks so much, Dr. Deane. It's so interesting. Really exciting to see this information presented, and definitely closed some of the gaps in my understanding in this area personally. We have a few questions that have come in. I guess the first question I have that I'll just ask myself that I noted a bunch of questions, but of course I won't take up all the question time. But the first one is I love that sort of candle, fire pit, and then forest fire analogy. Can you say more about that? Why does that matter? Why is it? I guess this goes to, when I go to rheumatology conferences, I see how their studies kind of all bear out the importance of early intervention for RA or whatever, that it's, it's chances are better at getting someone to low disease activity or remission, sort of the sooner you get the condition well controlled or well managed.
Yeah.
I know you talked about this a little bit, but can you explain kind of the phenomenon for that? Why is it harder to get? Is it because there's a lot more antibodies running around, or why is it that it gets harder once it gets to the forest fire stage to get things under control?
Yeah, no, good question. So there's a couple of reasons for that, and I don't want to make you crazy with my forest fire analogy here, but one of the things we realize is that the further an immune disease goes, the more just pure destruction of an organ that it does, and it's hard to reverse that. So if we could look at this picture here, when a forest fire gets to that stage, that land is devastated. Even if you put the fire out relatively quickly, there's no trees left, it's damaged earth. That's the same thing in your body. So if you let something go so it blazes up at this level, it's going to damage a joint, damage a kidney, damage your skin. It's going to be really hard to heal and get back to normal. So that's one thing. The sooner you catch it before the damage happens, the better off you are in terms of healing up and having normal function down the road. We've really found that to be true in rheumatoid arthritis. If you can find somebody early on in disease within a few months that they first identify symptoms and treating them at that phase, it really prevents a lot of this other destruction. There's also another part to this, though, is the immune system evolves as it goes, and there's checks and balances within it that in a low-grade immune state, those checks and balances work pretty well to regulate the immune system back down to normal. And I'm going to skip through my slides here back to this part where the immune system now is regulated and balanced between anti-inflammatory and inflammation. It actually turns out that if you let the immune system go too long and burn too hot, so to speak, there's actually changes within the white blood cells that they are less likely to respond to regulatory measures, and so then they're always going to be very active. We know this a lot in rheumatoid arthritis. If the joint undergoes a lot of inflammation, certain cells within that joint transform into being always angry, always making destructive products, and always damaging the joint. So if you can catch someone before all those downstream processes happen, it's much easier to shut it down. I think those are the two big things. Catch it before there's actual damage, and then catch the immune system before it gets out of control and can't be shut down very easily. I'll get back to this picture.
Great. Yeah, thanks. Like that clarifies it. One kind of logistics question is I think Deb asks if the slides will be available after the presentation. We're recording this session and we'll make this available on the CreakyJoints website, and if Dr. Deane is amenable, then we could, perhaps include a link to download a PDF of these slides, if that's okay.
Yeah, that's great. I'd love to make them available.
Okay, thanks very much. Another question came in from Jackie, and I'll take her off mute here in just a sec, but just to give you the preview, she says, she asks, I have celiac disease, 3 years now, I'm 73 years old. How can I do the best for myself? And Jackie, I'm going to try to take you off mute in case you want to elaborate at all. I don't think I can find you on here actually. But yeah, I can't find her to take her off mute. But if you have any response to that,
yeah,
what can someone with celiac disease do to take care of themselves the best they can?
Yeah, if you can still see the slide, I jump back up here to the list of other diseases. So celiac disease is on the list. So Jackie, you caught me. So celiac disease is an interesting autoimmune disease where it's driven, we think in most cases, by an environmental factor, that is wheat, or the gluten within wheat, and within gluten a certain protein called gliadin, where that protein, when you take it into your gut, binds to other proteins and becomes a trigger for your immune system, and then your gut gets inflamed. When that happens, then your gut can't absorb things very well because it's inflamed, and then so you can have a lot of symptoms: diarrhea, weight loss, loss of nutrition, and then sometimes that inflammation gets so bad it can affect other aspects of the body, like it can be associated with arthritis or whatnot. So, but it's all driven by your body's exposure to this external protein, this wheat-based protein. So for celiac disease, for most people, the treatment of choice is just to avoid wheat or gluten-containing products. So there's a few other things out there that can contain gluten. Doesn't just have to be wheat. And so that's our first recommendation, and that's typically enough for most people. Although it's tricky because even with labeling on foods such as it is, sometimes there's gluten in products that you don't know about, and we even know that certain medications contain gluten within the medication as part of the packaging. So you have to take a special look at anything you're eating to make sure all gluten is removed. So for most patients, that's enough with celiac disease to get their inflammation to quiet down and their immune system to behave normally. Every once in a while, someone needs a little bit of extra stuff, and sometimes we'll actually give drugs to reduce the immune system in celiac disease, things like prednisone or other agents. But those are pretty unusual to have to go that far. Does that answer your question, or is there other things I can address?
I think she's probably muted. I couldn't find her name on here to take her off mute. Let's see if I can. She showed up now. Yeah, I apologize, Jackie. If you want to put something in the chat box and let us know if you have a follow-up question. Another question that I have, Dr. Deane, is why is it that tobacco, smoking, why are they implicated as a sort of environmental or behavioral exposure that raises someone's risk of an autoimmune condition?
So we don't probably know all the answers to that, but I think one of the things that most people would agree upon is that tobacco, especially in the form of cigarette smoke, really drives chronic inflammation in the body. So that inhalation of smoke induces inflammation, that irritation in the smoke induces inflammation largely in the lungs, but other places in the body as well, that drive the immune system and won't let it shut down, and then that's when the immune system can make mistakes. And it's a little complicated because in smoking there is a big risk factor for lung cancer. We actually think in that case it's the chronic irritation from toxins in cigarette smoke that can actually irritate your cells, lead to genetic changes, and then they develop cancer down the road. But interesting, smoking actually has adverse effects in other aspects of the body and not directly exposed to the smoke. Like, for example, smoking puts people at increased risk for bladder cancer because some of the toxins from smoke go into the lungs, get into the bloodstream, go out to the kidneys and sit in the bladder, and then can irritate the bladder and lead to cancers in the bladder. But all this kind of chronic inflammation can also drive other immune processes and drive the development of autoimmunity. This is sort of back to that thing where if the immune system is chronically stimulated, that's when it makes mistakes. If it doesn't return back to the balance that it likes to be at, then we can develop these immune mistakes and then drive autoimmune disease. There's another idea that perhaps smoking actually changes your body's proteins a little bit. So one of the concepts in immunity is that if your protein that your body made from birth, your immune system says, aha, that's the person I live with, I'm not going to affect that. But cigarette smoke may go in there, alter that protein, and the next time your immune system encounters it may go, hey, that protein doesn't look right. It doesn't look like it was something I was born with. It looks like something different. Let's attack it. And if it's just altered a little bit from you because of the cigarette smoking, then that can start an immune process, and that won't shut down appropriately.
Great, thanks. Yeah, that clarifies it for me a lot, actually. Another question came in, looks like from Candace, and I'll take you off mute here, Candace, but the question is, what is a good resource or website to look for ways to support or participate in research studies if you don't have one of the big three, and some of the ones we've been talking about, RA or diabetes? So Candace is saying she has COPD or CPPD. Let me take her off mute here, Candace, so you can talk. There you go. Candace, you should be off mute now if you have anything to elaborate.
Not too many things to elaborate, but most of the time when I come across any kind of ongoing studies, I'm like, yeah, I want to do that. And then it's like, oh, you have to have RA. And I'm like, no. So like I would be all over that, at least for like clinical type of trials. Well, actually, that's not even true. A lot of times, even if it's just kind of like we want to even know your opinion about things, you can't even necessarily chime in the arthritis community if you don't have a specific type of arthritis, and mine is very rarely listed. So I don't know how to just like, here's an all-inclusive list, and I don't know if that exists somewhere to kind of keep, periodically coming back to check for new studies that get added, or there's a good resource for that. I don't know.
Yeah, Candace, this is Kevin. You raised a very good point. A lot of times, diseases or research projects are disease focused, or even other information is very disease focused. I think in a way we have to wait a little bit until the whole field starts treating autoimmune disease a little bit more broadly. Then we can kind of see all the branch points and say, well, here's an autoimmune disease interest site, and that'll have all the other things listed. I think sites like CreakyJoints are kind of on the cutting edge of that, so I keep checking with them. As far as specific trials, sometimes those are also limited by the region that you're in. So like if you live in Florida and there's a study in Seattle, Washington, it's kind of hard to participate. But one of the places you can go is the clinicaltrials.gov, which lists a lot of the trials that are available in the United States and actually beyond the United States and some in foreign countries as well. And they have a pretty good search engine on clinical trials where if you have, again, it sort of limits you to the disease type, you can look for that. So I apologize, I don't have any better answers for you. But Ben, if you guys have any other thoughts for her as far as web-based resources, that'd be terrific.
Sure. Yeah, that was my recommendation too. The clinicaltrials.gov website to look for, could search by condition there. And we are developing. I don't think it's gone live yet, but we have a few pages on the CreakyJoints site about clinical trials in general, where we'll list a few. But I think, as Dr. Deane mentioned, I think the most comprehensive resource is probably that clinical trials website that any of us has access to look up trials or studies that are going on to get involved with current research, at least that type of research. Another question came in from Doris, and she asks, if someone has one autoimmune disease, it sounds like they may be prone to others. Is that true? And can you talk about that phenomenon a little bit?
Yeah, Doris, that's a great observation. It is exactly true. If someone has one autoimmune disease, they may be prone to other ones. We think that's in part because there's probably some genetic regulatory things that run into families, and so some abnormality of regulation may predispose you to one or other diseases. It could also be that there's an environmental factor that drives different types of diseases. That said, autoimmune diseases kind of run in families. And so just because you have one doesn't mean you're going to get all of them. So hopefully that's somewhat comforting. But what we typically see is type 1 diabetes and celiac disease kind of run together pretty closely. Thyroid disease also runs with that group. Lupus tends to kind of be on its own, although thyroid disease can also be present there. And then rheumatoid arthritis tends to be on its own. There's a little glimmer of data that maybe type 1 diabetes is associated there. But those are sort of the big families of autoimmune diseases. So this is why most healthcare providers are aware of this, and so they know that if you have type 1 diabetes, they look for thyroid problems and celiac disease as well. With lupus, we watch for thyroid disease. With rheumatoid arthritis, we occasionally watch for thyroid disease and diabetes as well. But fortunately, that once you get one, doesn't mean you're open for all of them. But there are sort of families. And understanding that is hopefully going to lead researchers to find certain pathways and ultimately preventive strategies that's going to help with each one of those diseases. Because RA looks different than lupus, there may be some fundamental differences that ultimately will help us figure out who gets these things and ultimately how to stop these things from happening.
Great, thanks. Another question that's come that I see discussed comes from some of the discussions in our patient communities. There's a lot of discourse around reversing an autoimmune condition that's already been set in motion. Is this, is that a phenomenon that is true? What does that mean exactly? And I guess this question grows out of the fact that many patients might feel resistant. They might, hesitate to start a medication or to treat an autoimmune condition until they receive what seems like a more sure or confirmed clinically diagnosed condition. So I guess, so I guess kind of two questions in there. What is kind of the reality about reversing an autoimmune disease that's already been set in motion? And then what kind of education can help to address this sort of what do you think is needed to make sure that patients get the treatment they need before things kind of get to the campfire or forest fire kind of phase? I guess that's always my personal concern about waiting too long to start treatment.
Yeah, that's a terrific question. I'll answer the maybe the easier part first. So we do think people can have reversal of immune system problems. In the degree to which they can reverse it is sort of dependent on each patient and how far into the process they are. So some people can be at, and Ben, you refer back to the slide, and I pull it back up. Some people could be in the campfire stage, but let's say that was a rash on your face at that campfire stage for your autoimmune disease. It's really easy. You'd pick it up right away, and you may go into the doctor, but there may not be any other damage yet. That may be able to settle down with minimal therapy before there's a lot of other damage to other parts of the body. So like in lupus, for example, you can have rashes, but then one of the worst things is having bad kidney disease. So if you just have a rash, great, no kidney disease, you might be at the campfire stage here. Kidney disease and a rash would be more at the forest fire stage. So if you catch it early, we may be able to either, I think the term reverse, or halt you from progressing to the more advanced phase if we intervene with some kind of intervention. I'll talk about that in part 2 of this, what that is, whether that's a medication or other kind of intervention. But you can reverse it. We're also learning more that people can reverse autoimmune diseases on their own, and we've learned a lot of that in Colorado, where we do natural history studies where we identify people with abnormal blood tests for an autoimmune disease, but they feel fine, and you check them again in a year, and all those blood tests have gone away, suggesting they have an immune system that went bad for a while, and then it reset itself back to that balanced phase. We're trying to learn more about that, trying to learn the things that people could do to get back to that on their own. But I will say, from my doctor standpoint, a lot of times we can see people and realize there's either been a lot of damage or really, really high risk for progressing to worse damage or even death from an autoimmune disease. That's when we're going to really try and convince you, like, you got to take drugs that we have studied and know work. But there are still times when disease may be mild, and that may be a chance for having something less powerful than a medication, such as a lifestyle intervention like sort of eating right, stopping smoking, exercising, losing weight. There may be a time for that for certain individuals. I don't have a great answer for everybody, but I would say talk about these things carefully with your provider. If you are in an early phase of an autoimmune disease, what are their thoughts about your risk for progressing, for having irreversible damage, and what their thoughts are on what's the best approach to either get this disease to reverse or at least to prevent getting progressive damage. I will defend my rheumatology position by, a lot of times people come in and really don't want to take medications. I'm really convinced that they ought to, because we've seen a lot of folks with these things and we know it's going to get worse. We try and keep the dialogue open, but just be open to hearing what your healthcare provider has to say about what you should do to try and reverse this, and just be open and open to dialogue.
Great, thanks. What's meant by the term preclinical, like a preclinical condition?
Yeah.
What does that mean, from a medical perspective?
Yeah, so that's a great question. There's a huge fight in the medical field about what that term means. My understanding now, and I think a lot of people agree, it is a stage of a disease where you feel fine, but you may have markers that you've taken a few steps towards disease. This could be maybe the candle phase of disease or very early campfire phase of disease, where something's wrong if we look hard enough, but you feel good. In those terms, the pre means before, the clinical means before you're clinically unwell or sick. So I think that's a pretty good definition for that. Now, people are debating this because technically, maybe all of us are preclinical when we're feeling healthy because we're at risk for all kinds of things down the road. We're at risk for a heart attack, we're at risk for a car accident, so we're kind of pre-car accident. One of the debates is, can you say you're pre-anything if you never actually develop the thing that you're talking about? Like, could you have pre-rheumatoid arthritis if you never actually got rheumatoid arthritis? Well, we don't know yet. I'm still convinced you can say pre-something, because as we move forward and we are more able to intervene on people and actually prevent them going on to that next bad step of the disease, I think that'll be important. I'll use an example. I think something that's a little more well accepted. There's a medical term, pre-diabetes. So this is somebody who has abnormal blood sugars that don't quite meet the definition for full-on diabetes. That is a really important label to give somebody, because it means, hey, you got something going on, make some changes now, and you may not go on to getting the real diabetes. And then for that particular disease, actually, it's a great example of lifestyle changes can really make a difference. Weight loss, eating right, can really take somebody in pre-diabetes and reverse them back to a not diabetes at all phase. And that's what we kind of hope to be able to do in autoimmune diseases as well. But that label of pre-diabetes really gives people something to hang their hat on, make them sit up and take notice. Something's gone wrong. I better pay attention now and reverse things. And I think that's going to be very applicable going forward to autoimmune diseases as well.
Great, thanks. So Chantel submitted just a suggestion. She said that Clara Health, spelled C-L-A-R-A, Clara Health, apparently has some great information on clinical trials as well for the person who asked that earlier about where to go to find research. So another question. Yeah, another question about, you mentioned, I forget, it's one of the slides, I think, maybe after this one, about what's kind of coming soon. Yeah, here it is. Yep, just there. Coming soon might be medications, nutritional supplements, things that alter the microbiome, or vaccines. What I guess a lot of people in the patient community, I see a lot of conversations about supplements that seem to work for them, or reduce inflammation, like turmeric or things like that. So can you say more about like sort of supplements in general, and then what do you mean by other nutritional supplements that could be coming in the future?
Yeah, so this is a expanding area, and I think it can be a very important area coming forward, especially if we can catch people at the candle or campfire phase of disease, where we think that tweaking the immune system through nutritional changes may really make a difference. I'm a little worried when people get to the forest fire stage, things such as only diet changes, again, supplements like turmeric or fish oil, which are commonly used for arthritis, probably aren't enough to shift things back to a controlled state. So what we really hope going forward is when we can identify people in these at-risk phases when their disease is very mild, that those type of nutritional interventions may be actually truly meaningful and really be able to hit reset button or really stop disease from developing. Hopefully that makes sense. Unfortunately, we don't have a lot of data that once you get really sick with an autoimmune disease, that nutritional changes alone or supplements alone can make a huge difference. There is some data, though, that fish oil supplementation in certain diseases like rheumatoid arthritis or even lupus can reduce disease activity, but that's usually in the setting of other agents as well that are kind of more classic treatments or drug treatments. But if those can help reduce the amount of drugs that you have to take, I think that's very good. So I think the real hope here is using these nutritional type supplements at the right phase of disease when they really make a strong impact before disease gets so far out of control that these things won't be able to control it. Hopefully that makes sense. Some of the other things are on the horizon. We have hope for them, like altering our microbiome. So we think there's probably bad bacteria that can reside in our gut that can drive inflammation. We're trying to learn now how if you change that, you can actually lead to better health. It's not clear in all conditions, especially autoimmune diseases, that that's possible, but people are looking into it. We're crossing our fingers that there's going to be some breakthroughs. But one of the neat things that's come out of that type of understanding is there's a disease called Clostridium difficile or C. difficile colitis. So this happens to people after they may take an antibiotic. It alters their gut bacteria from a healthy state to a disease state, and this particular bug, C. difficile, overgrows and causes a lot of inflammation in the gut, and can be quite disabling and even cause death. We have certain drugs that can help with that, but what we're really finding is taking a fecal transplant, so taking stool that's been carefully processed, from a healthy individual, putting it into the person who has this microbial overgrowth can really shut down that inflammation and return that person to a state of health. So that's not autoimmune disease per se, but it is an inflammatory condition that can really be altered by changing a person's bacteria back to a healthy state. And we hope that some of those things are going to be targetable in the future for autoimmune disease, again, at the right phase. I still think once you get to the forest fire stage, until we get a lot of new therapies that are probably a few years off, these things are all going to be very, very applicable in that candle or campfire stage of disease, when things are modest and little nudges with nutrition or other things are going to be helpful. Does that answer that question? It's a good question. It is a complex one, though.
Yeah, that's really helpful. Yeah, thank you. So you started, I think, early on about talking about osteoarthritis, and that there's it's kind of an emerging area where it wasn't necessarily considered an autoimmune condition, but now it looks like we'll one day treat OA more like an autoimmune condition. Can you expand on that a little bit? Talk a little bit more about what moves someone into that column, or has OA always been considered an autoimmune condition? We just have not treated it that way. I guess what's the kind of latest research in that area?
So part of it is our ability to look in depth at the immune system and particular tissues in the body and see immune activity has really opened the door in osteoarthritis. So, we used to see osteoarthritis really late in the game when a person had crooked fingers or really out of shape knee that had a lot of creaks and pops and cracks. At that stage, things have just been, if I can use the term, blown out and just degenerated, and you can't really tell much. But now as we've moved on and we are doing surgeries early on, people getting joint tissue earlier, and our techniques for evaluating tissue for immune responses are better, we can really see that tissue damage is very much related to inflammation in the immune system. And certain tissues are a little bit more amenable to healing in the setting of inflammation than others. Like if you cut your arm, for example, that generally speaking heals up pretty good. You may see a scar, but your arm still functions pretty well if it's just a minor cut. Turns out the joints aren't so forgiving, so cartilage doesn't heal up real well because it easily gets imbalanced to its inflammation and goes more towards the damaging side of things and the non-healing than the healing side. But understanding that in trying to learn how to manipulate that with drugs or other things, surgical approaches or injectable therapies into the joint, we really hope to be able to shift the inflammation that's part of osteoarthritis back to the healthy stage and even a regenerative stage at that point where we can get cartilage to regrow rather than just fall apart in the setting of inflammation. I think that's pretty vague, but that's sort of the best answer I can do now. We'll
okay.
So if you go out to your orthopedic doc right now and say, give me a pill that will heal my joints, we don't have it yet, but I think we're getting there. And it may not be a pill, to be honest, in the near future. It may be something injectable or like a cartilage transplant where we manipulate the immune system so that cartilage grows nicely instead of just falls apart in the same inflammation. Those may be the therapies, but it's on the near horizon.
Great, thank you. One last question, and then I know we're almost at the top of the hour again. So vaccines is on this kind of coming soon list, but I guess a different way of looking at vaccines. I think there's sometimes a concern that there's the anti-vaxxer movement and so on. Concern, I think if I understand this question from what I've seen in patient discussions, fear that getting a vaccine, I don't know, like a flu vaccine or some other kind of vaccine for a kind of worse condition, it could somehow initiate a cascade that would lead to an autoimmune condition. Have you heard that before, or can you comment on that?
Yeah, that's a concern. We really haven't seen a lot of that where people get a standard vaccine to the things like the flu, like you mentioned, or other measles, mumps, rubella, those types of things, and develop clear-cut autoimmune syndromes after that. So from a doctor's standpoint, we don't think that's a major risk. The flip side of that is we're using the term vaccine now more broadly in the sense that we can do things now to train the immune system to do a better job than it is doing. This is being harnessed now with, actually, this is reality. This is happening now, where we're training the immune system to do a better job at clearing cancer. So I mentioned that part of the normal immune system function is to clear cancers out of the body, but obviously people get cancer still, so it's obviously the immune system is not doing the right thing. We can now tell your immune system to ramp it up, and it's been really a breakthrough in therapies for certain cancers like melanomas, lung cancers, breast cancers, other kinds of cancers, where we turn on your immune system through basically a vaccine and tell it to attack a cancer. Vaccines can also be thought of as ways to retrain your immune system, perhaps back towards the non-inflammation or non-autoimmune state. And people are now working at taking individuals' white blood cells out of their body, they're active and they're abnormal, retraining them and then putting them back. So now they're a more regulatory type of cell. And these can loosely be all kind of lumped under the vaccine approach to autoimmune disease, where we're basically retraining your immune system without a drug, but to do its job better, either clear a cancer or settle down and not be so inflamed. Will these ever get to the point where we're just injecting you like a flu shot? I don't know. That's possible. There's a concept called tolerance, where if your body's attacking a protein and then you give your body a whole lot of that protein, it kind of overwhelms its response and then it just gives up and quits attacking it. It says, oh, well, whatever. There's a lot of this protein around. I don't need to attack it anymore. That might be something we do by injectable. There's also dietary approaches to that, where we can give people oral proteins and their body actually gets used to it then and stops attacking it. So all these are kind of loosely under the vaccine. So I would encourage people to keep an open mind about vaccines. They take different forms, and in some cases they can actually be very, very useful to making your immune system do a better job.
Great, thanks. So by and large, I guess the bottom line is, by and large, vaccines are a very good thing.
Yes.
Okay. So I think we're here at the top of the hour. If you could advance to that last slide, just so we have your contact information again. And just wanted to thank you. The immune system seems like a really remarkable system in the body. It's sort of the maintenance and janitorial services of the human body that does a terrific job. And it sounds like when things go wrong, it can have terrible effects. But there are certainly treatments, and we're also making progress in understanding ways to predict and prevent things from going wrong. So we really appreciate your time, Dr. Deane, in speaking with us this evening, and look forward to having more webinars in the future, with you or with other speakers. And as we mentioned earlier, we will make this available online. So thank you so much for your time.
All right. Thank you. Thanks all.